511 now, those COVID booster shots from all the manufacturers are now available, but who's being recommended to get one?
And is there an advantage to mixing and matching? We're joined now by Dr. Lynn Jeffers, Chief Medical Officer at Dignity Health St. John's Hospital, to discuss these latest questions. Doctor, Moderna and Johnson & Johnson boosters, they're now available. They have the green light along with that mixing and matching. So the question is, should people stick with their original vaccine if they can for a booster, or is there an advantage to getting something different?
Thanks for having me. And yes, that is a really good question. The National Institute of Health did a study. They took people who either had Pfizer, Moderna, or J&J, gave them a booster that was either the same brand or one of the other two brands. And what they found out was that there was no new safety concerns with the mixing and matching of vaccines, so that's good news, and that all of the brands boosted the immune response. So whether or not you should stick to your original brand or choose any other one actually depends on a couple of things. Number one, which vaccine you had first, and whether or not you have a higher risk for some of the side effects that are associated with one more than others. So for example, if you had J&J first, the data might lead you to lean toward maybe Pfizer or Moderna. But if you, say, are a young man at higher risk of, let's say, heart inflammation, it might make you choose one or the other brand. So the CDC will actually be coming out with clinical guidelines soon. But if you're not sure, you should talk to your doctor over the different options and see. But really, long and short of it, for most people, you can feel better knowing that it's okay to mix and match. You will get immune response no matter which one you get.
Now, a lot of people are wondering right now at this point, who should be getting a booster? Because we keep hearing different health officials with different recommendations. And most have been watching what Israel's doing with these boosters because they've had a large number of people in the hospital who are fully vaccinated.
Well, breaking it down for you, it's by the brand that you started with first. So if you got J&J first, it's pretty easy. Anyone who got J&J, so that's anyone over 18 who got J&J first and got their dose at least 2 months ago, should get a booster. It doesn't matter which one, as we just talked about. Now, for either Pfizer or Moderna, your last dose has to be at least 6 months ago. But anyone over 65 and anyone over 18 who has a high risk of severe COVID, so those are the immunocompromised people or people who have medical histories that make them at higher risk for severe COVID, should get a booster. And then anyone over 18 with a lot of high risk for occupational or institutional exposure, so those are your healthcare workers, your teachers, your frontline workers, those people are also eligible for a booster.
What does it say that J&J, you get it 2 months after you got the first one? Does it say that it does not protect you as long as the others?
It's based on the data that they have, and that's why they're showing that J&J, you can do it as early as 2 months. Whereas for Pfizer and Moderna, it's based on the way that the vaccines work. It's best if you wait at least 6 months to get your maximum efficacy from the time of the doses that you're getting. So it's less about whether or not it's waning, but more about how long we think you can get better protection and spread that out.
Okay, Dr. Lynn Jeffers with Dignity Health St. John's Hospital. Thank you so much for your time this morning.
Great. Thanks for having me.
Take care.